have paradigms and roadblocks that prevent us from excelling, and they can be real or imagined. Welcome to Beyond Bricks, a podcast that will give you the ability to break through those walls. Here's Dr. Nathan Unruh.
Welcome everyone to this conversation. I'm excited to be here with Dr. Ron Farabaugh, who has been a pioneer in chiropractic and has recently just released a brand new paper that we get a chance to talk about here today. And I think you're gonna be fascinated by what he has done with this paper and what we can do with it going forward. But before we get into that, Dr. Ron, first of all, thanks for being here with me.
Thank you so much. Appreciate the invitation to be here.
Tell me, just first of all, over 40 years in chiropractic?
Yes, I graduated in 1982 from Palmer and have been in practice ever since. Well, practiced until about 2018-19 when I had to sell my practice. Chiropractic has been a wonderful profession for me, but being the stubborn guy who needed to feel that bone move and practicing Gonstead for 38 years, and 5 joint replacements later, I physically could not do that anymore. So I sold my practice, and but it was, practice for 38 years. It was great. Loved every minute of it.
So 38 years, you've seen a few patients then?
Yes, I've seen a few.
But you've been, not just as a very successful as a practicing chiropractor, you've done a lot for chiropractic in the realm of research and something called the clinical compass and those guidelines. Talk to us about that.
Well, I first got involved. It was kind of funny how I got involved. I was one of those guys who went to my first state association meeting 100 years ago, and I'm listening to the president and the vice president, and those guys were so articulate and so intelligent and looked so corporate. I'm thinking, oh my God, I want to be associated with that. So I started going to these meetings, and I got involved. And next thing you know, I'm president of the Central Ohio Chiropractic Association, and Ohio State Chiropractic Association, and the chairman of the state board, president of the state board. And I'm sitting in a chiropractic meeting. I get this phone call from a friend of mine, Jeff Fedorko. Jeff, I'll never forgive you for this, who says, Ron, he's down in Florida at a Congress meeting, and he says, there's this new thing called CCGPP. I'm like, I don't know what does that mean? It's Council on Chiropractic Guidelines and Practice Parameters. He says, it's all about guidelines, and you need to be on it. And he lied. He says, don't worry, it doesn't take a lot of work. And so I said, fine. So I got involved in CCGPP 22 years ago. And at that time, I was just a typical chiropractor, just trudging his way through practice every day and loving every minute of it. But I got involved, and all of a sudden this group was some of the most intelligent, well-meaning, forward-thinking individuals I've ever been around. And I wasn't a researcher. I was just a normal chiropractor, right? But these researchers, what I found out, they are there to help. They're the most giving group I've ever met. You get on a team and they pull you up. They teach you the rope. They teach you how to do these things. And you don't start publishing papers. You get on a team and you're part of an effort to get a paper published. And next thing you know, 15 papers later, and then you have this amazing paper, The Cost Effectiveness of Chiropractic. And that was a heck of a journey from not knowing anything about research to heading a team of researchers that did a systematic review. And this team was amazing. PhDs, Mike Schneider and Clint Daniels and Cheryl Hawk. Cheryl Hawk has been my mentor for the last 15 years on these papers. She is just an absolute workhorse. Pumps out paper after paper after paper. She's like the most well-kept secret in chiropractic. She's just amazing. And Jim Whedon and Dave Taylor. And I found out the secret weapon of all these is the librarian. And we had a librarian, Clara Knoll, who was just amazing. She was able to find papers from 1991 that we couldn't find anywhere, but she found them. And so it's been an amazing journey of just getting involved and not being afraid to make a mistake. What we do in this world is, we fail our way forward, right? Mm-hmm. We make mistakes. So what? What's the worst that's going to happen? You make a mistake, and every time you do something, even like this interview, I'm sure I'm going to say something and I wish I could walk back tomorrow, right? Right? But the reality is you just keep don't be afraid to make a mistake. Don't be afraid to mess up. Just get involved and surround yourself with people that, you want to accomplish something really great in life. Surround yourself with people that are way smarter than you.
Right. Isn't that the truth?
And that's what the clinical compass is. It's just an amazing group of individuals that are just selfless.
Yeah, and it's just something that we recommend to our clients to use as to guide their care. It's so well done with research. So let's just transition for a moment. CMS is talking 2025 that they're going to be really wanting to move more to a value-based care system or reimbursement model.
Yeah, everything I've read is 2030. They want all payers to be basically involved in a value-based healthcare model. And what does that mean? Value-based simply means that you're getting the best clinical outcome at the most economical cost. That means we chiropractors, not just chiropractors, everybody in healthcare has to shift from the thinking of fee for service, where the more I do, the more I get paid, to the better outcome I achieve in the shortest period of time, the more I get paid. So it radically changes your thinking in terms of how to get the best result in the shortest period of time. But I think it's important to keep in mind, keep insurance in perspective. I think the reason I had a really good, successful 38-year career was because insurance to me was just marketing. I mean, because I'm on the list, patients would come into me, I would get them out of pain as fast as I could and transition them to self-pay. Because if we chiropractors just accept, and I think most of us agree, patients can benefit by chiropractic care birth to death. And I know there's some argument about that, but it doesn't matter. The reality is most of us agree, birth to death, everybody needs it. But insurance, you might need this much in your lifetime, but insurance only pays for this much of it. Mm-hmm. And if you just quit fighting that, insurance is not health care. What we do with our patients, what patients do with themselves, that's health care. Nobody's responsible to keep us healthy but us. It's not the insurance company's job to keep us healthy. It's just their job to pay when we wreck our bodies, kind of like car insurance, right? Mm-hmm. You dent a fender, they're going to pay for it. They're not going to pay for your oil changes and your, tire rotations and fluid, transfers and everything. They're not going to pay for that. They're there to cover the wreck. Insurance companies are there to cover your physical wreck, and that's it. They're not health insurance. They're not health care. It's just insurance for a sliver of care. And if we just start to think in those terms, we can survive really well within an insurance environment by keeping it in perspective. And if people would just read the clinical guideline papers, the old days of, I was raised 1,000 years ago in chiropractic, right? Back then it was get your PVA as high as you can possibly get it, right? But that included everybody in your practice. But in the insurance world, the reason the patient visit average number is so low, it only includes the acute phase. So think about this. If you stripped away wellness, if you stripped away chronic pain management, and all you did was measure how much care it took for the acute phase, that's why the number is so small. Could be 6, 7 visits. That doesn't mean we expect to treat a disc in 6 or 7 visits. That's not what that number means. It's just an average. And as you and I were talking earlier this morning, our data from the company I work with now, AMI, as their medical director, from across the country, payer after payer, anywhere from 10 to 20% of all the patients we see only come 1 or 2 visits. That's our own data from our own company, right? Why is that? Well, we don't know really, but it's either faith, confidence, belief, time, or money, right? Mm-hmm. Either they don't have the money for the copays that are getting so high anymore, or they don't have the belief that they need that much care, or maybe it's time, they can't get that much time off work. But for whatever reason, 10 to 20% come in 1 or 2 times. The reality is, to get out of pain doesn't take that much. We get really good results in chiropractic. And I can tell you from my perspective as a medical director, we need to stop arguing. We chiropractors argue so much over dumb stuff. The reality is, because I see the data, I don't care if you're a NUCA practitioner, a chiropractic biophysics doc, a Gonstead doc, Thompson, Pierce, it doesn't matter. We all get great results. And guess what? We all get great results very quickly compared to what we think we're getting. So the trend now is simply evaluate, treat in short bursts of care, 2 to 6 visits, reevaluate, treat, reevaluate, treat, and just repeating that process until you reach a plateau. And then at that point, you give them an option. You can come in only when you're hurt. That's typically covered by insurance. Or you can transition to once a month. Now, why would you do that? And we go over the literature about the value of monthly care. Hey, look, it's $40 or $50, whatever your fee is. And I always suggest, look, that's a Starbucks and a muffin. And I hold up my cell phone and say, so don't even think about coming in here with a $1,000 cell phone and tell me you can't afford $40. If you do, I'm going to beat you to death with your own cell phone. So I think if people just relax a little bit and just realize insurance pays for this, what you need is this. Mm-hmm. You just have to have a reasonable fee schedule so people can afford what you do. Mm-hmm. And, forget the PVA of 6 to 7. Mm-hmm. Patients should be going to a chiropractor their whole life. Mm-hmm. I mean, at what point don't you need a normal, healthy spine and function and to be able to exercise and move? It's your whole life.
Yeah, I agree with you 100%. And as you listen to Ron here today speak, we do have to shift a mindset on what is insurance and what is it not.
Right.
We don't have to make them into this big bad thing. It just is what it is.
Exactly.
Right? And I love your perspective on that. So let's transition to talking about the paper.
Okay.
So just dive into the paper. I think this is great stuff. I love it.
Well, the paper was, a brainchild of, if we want to change what's happening in chiropractic and in the world of reimbursement around the world, Lou Sportelli 1,000 years ago to me said, look, we're in a war and evidence is our best weapon. I never forgot that. We're in a war and evidence is our best weapon. And so we realized we have to create, we chiropractors, we inherently know we are way less expensive. And there's tons of data out there to suggest that, but we didn't have it organized in one place. Now, there's been systematic reviews in the past, but I think this one, do you ever wake up one day and think, man, I am in the right place at the right time? Mm-hmm. I'm not thinking about that person. I'm thinking about our profession. Mm-hmm. Our profession's at the right place at the right time. We have an opioid epidemic that, with all the lip service that the world has done about that, if you look at the latest graph of the use of opioids, it is at a peak. In 2021, there are more opioids given than any time in our previous history, despite everything we know about opioids and how bad they are. And so we needed a paper that said how effective chiropractic is compared to the medical care. And this isn't about bashing medical care. It's just simply about saying, how good are we? So we began this process. And again, thanks to our librarian, Claire Knoll, we started this process with 2,400 papers dating back to 1991. And we had to cut it off at some point. So in 2021, I believe it is, or 2022, we cut it off in October of that year, because there's been really cool research papers that come out since then. Even people kept sending us research. I'm like, man, we have to cut it off somewhere. We have to have a beginning and an end point. And the next systematic review will include all those new papers. But 2,200 papers, 2,400, somewhere around there, and we called that down. We looked at each one. Our team, we had a divide and conquer strategy. We divided them all up, and we ran them through our process of what we're going to include and what we're going to exclude. And if they didn't have a comparison between chiropractic and medicine, it got excluded. If it didn't have an analysis of cost, it got excluded. If it wasn't U.S. data, it got excluded. Certain populations were excluded. But what we came down to was 44 papers. That all of them were rated for quality and validity and the strength of the evidence. And we took those 44 and then extracted the data. We broke it up into teams again, extracted the data. Every paper was analyzed by at least 2 investigators. And if there was disagreement, we got a third investigator to break that tie. And then we compiled all the evidence, all the cost data into some charts. So there's 5 different charts in that paper. I would suggest everybody take a look at them. They're really good to evaluate and see how we did compared to medical care. And Table 5, for example, is a really beautiful colored chart that visually summarizes the results. How many papers show we're more cost-effective, as cost-effective, or not as cost-effective. And there's only a couple that show we're not cost-effective. But that's where they're comparing what happens in a PCP office to chiropractic. Now, when somebody thinks of chiropractic, for example, too often we reduce the entire profession of chiropractic down to the singular treatment of spinal manipulation. But as you know, we're way beyond that, right? So when somebody goes to a medical physician, a primary care doc, just remember that's the tip of the medical iceberg, right? So get used to a term called downstream services, downstream costs, because that's what we looked at. So if you go to a PCP, that's fine. He does an E&M. Well, if you compare that E&M to everything we do, because remember, chiropractors, we're both a physician and also the therapist, right? We not only diagnose them, but then we treat them. Where the PCP might diagnose them, and then they're off to the pharmacy for drugs, off to the PT for PT, off to the pain management guy, off to the imaging center, off to the injection guy, off to the orthopedic surgeon, right? So that's why the PCP is the tip of the medical iceberg. So it's not too shocking to think that, yeah, what we do in chiropractic, since we're both the physician and the therapist essentially, that's more expensive than a typical PCP visit. But when you add up all the downstream costs, we are far less expensive. And so we started this process. We had no bias. We were going to let the data tell the story. The data tells the story. And whatever story that told, that's what this paper was going to show. But we had a sinking idea that we were more effective, cost effective. But we didn't even realize just how massively cost effective we really are. So when you look at the data, there's 2 things that came out of that paper. One is when you go to a chiropractor, it saves in downstream services and cost. And what are those? Advanced imaging, MRI, ER visits, hospital days, opioid use, referrals to specialists, invasive injections. When you go to a chiropractor, all those things reduce. And the second takeaway was not only is chiropractic more cost effective, but how fast you go to a chiropractor is important. Who the patient goes to first matters. That should be on every marketing piece that goes out from chiropractic. Who you see first matters. If you go to a chiropractor first, costs go down even further. And that was pretty exciting to see that. So our recommendation in the paper that we struggled with, because there were some that didn't want that recommendation in there because they thought it was too strong. And I thought, no, it's not too strong. I mean, how many papers do you need? It's 1991 to now, basically showing that chiropractic saves money. So the recommendation was payers should be considering decreasing the barriers to access to a chiropractor, lower copays, lower deductibles, no pre-authorization, actually creating economic incentives to go to a chiropractor first instead of last. And so we need to take that paper everywhere, because especially the legislature, because everybody looks at here's what happens. It comes down to very simplistic. Here's a budget. Here's line items on a budget. Chiropractic, okay, 30 million. So if we want to save money on chiropractic, let's just cut that down to 20 million. We'll just decrease the visits, or decrease the cost, decrease their fees, whatever. What they're not realizing is that one line item affects 15 other line items down below it. Mm-hmm. So we've got to educate about the whole issue of downstream services, downstream costs. Mm-hmm. So yeah, not only do you not want to lower chiropractic, you want to actually increase the budget for chiropractic, mm-hmm. because that has a significant return on investment in those other 15 line items down below. Mm-hmm. Again, advanced imaging, surgery, injections. I mean, the list goes on.
Mm-hmm. So, okay, I mean, it's such good stuff here. And like when you said you went into this paper thinking we know we're more cost effective.
Right.
But you took the data and went even deeper from 1991 research all the way to today.
Right.
Lots of data. Now, how do we get a different result than what we've wanted to in these conversations in the past? So there's the old adage, if we're not getting the right result, we better change our approach.
Right.
So I want us to dive in to say, it's right here. This information is awesome.
Right.
Number one, chiropractors need to know it.
Right.
Number two, we got to start some conversations, right? And we need to start the conversations with the right people.
Right.
And how do we do that? So what are your thoughts on that?
That's a great question. So if we take this paper and we take it, and hopefully we don't just read the highlights, we don't just read the abstract, but we read the whole paper. If we take that and set it on a shelf, it made us feel really good temporarily, but it didn't do us any good whatsoever in changing chiropractic and people's access to chiropractic. So the question is, who do you take it to? Now, our knee-jerk reaction is to want to give it to every payer. And every payer should have this paper. But the question is, who in an insurance company needs this paper? Is it the medical director? Is it the chief financial officer? Is it the actuarial companies? Is it the salespeople? Who needs this? And so we got to strategically plan who to give this paper to. And I just hope everybody starts taking this thought into account. Who is taking the financial risk? That's who needs this paper. Because keep in mind, who pays the bills? Pretty much the large self-insured employers, right? If you think about insurance, half their business of insurance might be taking risks. They take financial risk. They'll take a book of business from the state to cover Medicaid. Medicaid gives them X amount of dollars. So if they can treat these patients with less than the state gave them, they make a profit. If they can't do that, they don't make a profit, right? So they're interested in lowering cost. So we have to identify who's taking the risk. Part of the risk is an insurance company, and the insurance company, other half of their book of business might be what's called an ASO, Administrative Service Organization. They are just administering the benefit that a payer, an employer might give to them. Say, okay, this is our benefit. We need you to basically pay the bills, take them in, because that's not what we do. We make widgets. We don't want to deal with this. You deal with this. But they're not taking any risk. So who do we have to take this paper to? It should be taken to every big, large employer. It should be taken to the unions, to the actuarial companies, to the consultants who are advising the companies how to form plans that have ridiculous copays and deductibles that serve as a barrier to going to a chiropractor. We have to convince those salespeople and those actuarial people of the damage they're doing unintentionally. They just don't know because we haven't educated them. They just don't realize when you create a barrier to go to a chiropractor, you're increasing all of those downstream costs. You are actually shooting yourself in the foot by doing that. So you need to create plans that have literally no barriers to access, zero copays, zero deductibles. In fact, create economic incentives to go to a chiropractor early on, right? And if we do that, and we need to organize state by state. We need to organize, and everybody needs to get involved. Everybody needs to be, if you're out there and you don't belong to a state association, I'm going to highly encourage you, belong. Go join today. Because the strength of chiropractic in our country is in direct relationship to the strength of our state associations. Our state association's strength of them is direct proportion to our paid membership. We have to have a good, strong membership. I mean, you know how hard it is to go into a legislator, and the first question out of their mind is, or out of their mouth is often, well, what percent of the population do you represent of chiropractors? If that number isn't greater than 50%, do you know how hard it is to argue anything? We have to have much greater than 50% membership in our state association. So if you're out there and you don't belong to state association, please join today. We have to do that. And we have to be involved members. And I know everybody can't do that, and that's okay. But we have to have more people willing to step up to the plate, because the leadership in South Dakota is a great example. Superb leadership in South Dakota. But they can't do everything themselves. They need members from the field to join this fight. We have to organize. identify employers in each state. We have to have teams of people in CCGPP, or now called the Clinical Compass. We're creating resources for you to be able to take this paper out, PowerPoints, bullet points, marketing pieces, to be able to take this paper out and educate employers, educate the media, educate legislators. We need to educate everybody about the value. We've got to have good, solid marketing things in our own offices so patients understand that they're in the best place they could possibly be for their health care. Not just getting out of pain, for their health care. They're in the best place.
So what's the best place for doctors to go to find the paper, to find all these resources you're speaking about?
That's a great question too. Go to the Journal of Chiropractic and Manual Therapies and just scroll down where, they're listed in the order they were published. And while we were at the top because we were the newest paper, now we're down about 5. They published a couple papers since then. So just scroll down until you find the cost effectiveness of chiropractic versus medical management of adults with musculoskeletal spine pain, a systematic review. And click on that, and that'll take you right to the paper it's free. It's open access. You can download it for free and just download it in your computer, print it out, read it. And then there's a little button there that says cite this article. If you just copy that link, send that to everybody that you know, so they can go ahead and copy that or go to that paper and download it themselves.
Awesome. Okay, how about the Clinical Compass? Talk about the guidelines and some of those things. Where can people go for that?
The Clinical Compass, I'm glad you asked that question. We have what's called the Clinical Compass Evidence Center. And the Clinical Compass, for, again, the last 15 years has become highly organized. And again, with Cheryl Hawk, who's just an absolute warrior in our profession, she kind of organized, along with her team, the resource center. So you can go to the Clinical Compass. Would encourage everybody to belong to the Clinical Compass. It costs like $5 a month or something like that. It's literally nothing. And join that, and you have access to dozens and dozens and dozens of papers. All the clinical practice guidelines we produced for the last 15 years are on there, as well as other important papers of moment, and organized year by year, topic by topic. And you can go there if you need a research paper to go, you're going to go meet with a legislator, you want to educate your local MDs. There's some super good research that you can just pull out, download for free, print off, and go to town. There's so much information on that website, and I hope everybody goes and joins the Clinical Compass. Just go to theclinicalcompass.org, and you'll find the Evidence Center.
Okay, so let's talk about that for a moment, of just when Lou Sportelli came to you and says, we're in a war, and our best weapon is research, is evidence. Yeah. So this is a great resource. So I know there's, NCMIC does a lot of work in funding research. The Clinical Compass, the organization is doing a lot of that work, right? Where else can we send doctors? I mean, is this the best resource? I mean, this is the one I've used over the years to help. Is this the best place to go for doctors to be able to really understand all the research?
The short answer, I think, is yes. First off, let me give kudos to NCMIC because they've been instrumental in funding Cheryl Hawk and a lot of the research has been done by CCGPP. So thank you, NCMIC. You've been awesome at that. But the Clinical Compass, I don't know any other place I can go to get so much valid information related to our profession.
I agree.
In a short period of time. I mean, you can go to each journal. Each journal, obviously, you can go to PubMed and look up. Every now and then I'll have an MD say, there's no research in chiropractic. No research in chiropractic. If you go to PubMed and type in the word spinal manipulation and hit send, in 1.5 seconds, you'll have about 16,000 research papers. I mean, there's so much research, you couldn't possibly read it all. If you spent, literally, this is a statistic. When I first got on CCGPP, it takes 17 years for research to reach the marketplace. That's what the statistic was 22 years ago. Well, now, thanks to social media, people like yourself, it takes about 17 seconds. So the question is, are you going to use the information? And to the detriment of society, this is my only negative medical thing I'll say. They're not listening to their own guidelines. It's called guideline concordance. When you're not in concordance with your own guidelines, patients suffer. Mm-hmm. And right now, everything from the American College of Physicians, American College of Family Practice, the NIH, WHO, CDC, everybody is recommending non-pharmacological treatment for back pain first before you even think about giving a drug. Mm. But yet when the average patient goes to the average PCP with back pain, what's the first thing that happens? They give them a drug. Mm-hmm. Yeah. My brother is an MD. He works in the emergency room. I'm very proud of him. He works in the emergency room down in Atlanta, Georgia. But when patients show up in the emergency room with back pain, guess what they get? And my brother's up on research, mm-hmm. right? But they still get a drug. And I was the chairman of the chiropractic department of a hospital in Columbus, the first one in Columbus. It may have been the first one in Ohio, I'm not sure. But that didn't last too long because they loved our referrals. Man, the hospital loved chiropractic referrals. They did. But when I tried to change the algorithm of when a patient came in the emergency room, okay, we need to have chiropractic in there as one of the referral choices for these back pain patients. They refused to change the algorithm despite the research, despite the guidelines.
So why though? Why do you think? Money?
Because the orthopedic surgeon said that's going to decrease my business. The physiatrist said that's going to affect my business. The physical therapist, that's going to affect my business. The imaging centers, that's going to affect my business. It was 100% about the money. Mm-hmm. It was sad. Yeah. It was just about creating the economic insulation that they needed mm-hmm. instead of what was best for the patient. It's a sad reality. Yeah. And it's that way today.
Yeah. Yeah.
So,
well, I'm reminded of a quote as I listen to you. And it's the quote that the gap between ignorance and knowledge is far less than the gap between knowledge and action. So we have the knowledge. So true. You have this labor of work, and it is our responsibility to now do something with it.
Right.
And I love what you said. Just don't go put it on the shelf. Right. So just to recap, action items of that. Get this to as many people as we can. Start conversations. Start to change our mindset about what insurance is and what it is not. Right. Start to get this in front of our legislators. Make sure that we're joining our state associations and understanding this is the value that they can bring by making sure having more conversations to keep chiropractic in the forefront.
Right.
The evidence is there.
Right.
But now we have to do a better job getting it to the right people.
That's right.
Was there anything when you were doing this work that just was a big aha for you?
For me, the big aha was how much research there was. I had no idea. I mean, think about this. We identified 2,400 papers that had some mention of chiropractic costs, chiropractic outcomes, and I was not prepared for the absolute mountain of information we had to dig through to get down to the absolute diamonds at the end, right? The golden nuggets at the end. And so the big aha for me was there is so much research. You can't ignore this research forever. Mm-hmm. And the other aha was just how significant the cost savings was. Mm-hmm. I mean, if anybody doubts the value of chiropractic, it's only because they haven't read anything. Mm-hmm. I mean, if somebody makes an ignorant statement of there's no research on chiropractic, you may as well stamp right on your forehead, I haven't read research in 25 years. Mm-hmm. I mean, there's so much research. That was the big aha for me. I mean, it was just amazing how much there was.
And, with all that research that's there, with what you've seen in the profession and looking to the future, What wisdom do you want to give people outside of what you've already given us? What needs to happen?
Well, I think the big thing is just if people would follow just two guiding principles. Mm-hmm. Number one, if you can help somebody, tell them. If you can't help them, tell them that as well and make a referral. Mm-hmm. Live your life that way. Secondly, give a patient what they need, only what they need, nothing more, nothing less, always. Forget insurance. They pay for this much of what they need. This is what you need. This is what insurance is going to pay for. Mm-hmm. So don't get hung up on the insurance stuff. Insurance hasn't given me a raise in 25 years. Yeah, they haven't given anybody a raise in 25 years. My brother argues about the same thing. He hasn't been given a raise in 25 years. And, forget insurance. It's there for a reason. It keeps you from going, bankrupt if you need an emergency surgery, even though 50% of the bankruptcies occur because of medical care, and those are people that are still insured. I mean, insurance pays for a part of it. That's it. And I think the big mission here that we chiropractors have to embrace is sharing the value of chiropractic on an ongoing basis, but doing it knowing what's coming in the future, because value-based modeling is like a freight train coming down on us, and I am concerned that our profession's not prepared for that. So we're going all around the country teaching seminars on how to prepare for value-based care. What does that even mean? And how to get the best clinical outcome in the shortest period of time, instead of how to make the most money by getting the most visits. That's the old school of chiropractic. That has been replaced by you got to become efficient. You got to provide value to society. And we do provide value, but not all chiropractors are the same. And the biggest, I think one of the biggest weaknesses we have as a profession is our treatment variability. You go to one chiropractor, he wants to do 36 visits. You go to another chiropractor, he can do it in 8 visits and get the same outcome. Well, how is that possible, right? So we have to get better at following our own clinical guidelines and evaluate, treat, discharge, self-pay. If we just did that, it's so simple.
What you just said there is brilliant and simple, and you're right. Make a recommendation, evaluate, treat. I mean, do it simple.
Yeah, do it in small chunks. And all of a sudden, we're super efficient, super cost effective. Mm-hmm. And patients, I'll never understand people who, I know there's some controversy about this, but patients who don't get adjusted on the first visit. And I understand the theory behind that. We don't want to create it in a patient's mind that we're just pain relief. But I look at it almost the opposite now, because I don't want a patient referred to me going to the person that referred them that says, well, how'd you make out? Well, I don't know. He didn't do anything. I feel the same. No, I want that patient going to the person that referred them saying, oh my God, I've been going to this medical route for 8 years. I go to this chiropractor one time and I feel 50% better already. That's what I want. You want to create referrals for life? Get patients fixed as fast as possible. Get them telling that story. You don't even have to say, tell your buddies about me. No, just tell your friends about your experience with chiropractic, knowing full well they're going to be talking about you when they're telling that story, right? But get as good a result as fast as you can, and people will be taught. You'll have business for life. Mm-hmm.
Yeah.
Right?
Totally agree. So one thing I was surprised as I went through your paper and had some conversations with doctors, I'm amazed by the number of doctors that are involved in insurance companies, meaning they sign and that they're going to be a provider, but they never read the physical medicine guidelines of that insurance company.
That's right. They don't read the policies.
Which is, I think, another mistake. Because I love how you look at it as, sure, to you look at it, it's marketing, right? Mm-hmm. I also look at it, from my perspective, has always been, they're kind of my business partner.
Right. That's exactly right.
Right? So I better know, if I got a business partner, what are the rules and regs that are there? And I can't get too upset about them. Mm-hmm. I just got to play within their range, right?
Right.
And I love how the clinical compass lays out that, lays out maintenance and wellness care, lays out how we should treat acute conditions. Mm-hmm. So I just want to commend you. Thank you for doing this work.
Thank you.
I know it's a lot of hours and it's a lot of commitment. And that's where I just want to end. What keeps you going to do this work? Because I know it's not the money.
No, I appreciate that. Yeah. My wife's wondering, are you ever going to start getting paid for that kind of stuff? I don't know. Maybe someday. I don't know. But the reality is, I just love chiropractic. I love helping people. I think we have an amazing profession. I mean, when you think about the miracle of what we do, every day we go to work and we get patients fixed with nothing more than our hands.
Yeah.
It's an amazing thing. Mm-hmm. Now, yeah, it didn't take long in chiropractic to realize if you can do what we do for a living, I better have lots of tools in my tool belt
Right.
because what might help one person is not going to help another. So I've developed more tools along the way, but the reality is it's mostly this.
Yeah.
And I just have always loved that. And I loved, by getting involved, I mean, every level of involvement helped me stretch as a chiropractor and as a person to a place that I never, ever envisioned myself ever getting to. And that was really a fun thing. A personal growth thing for me was just, 40 years ago, did I ever think I would be leading a team to do a systematic review? Heck no. I didn't even know what a systematic review was, right? So I think what keeps me going is just, as long as I feel like I can contribute, and it's to me, it's just fun. I love being around people that are forward thinking. Mm-hmm. And I avoid like the plague those people that want to drag this profession down by arguing about silly things. Mm-hmm. You know, if you look at both extremes, you know, the extreme of the evidence-based guys here and the really super hard philosophical guys here, we're never going to agree 100%. But I'm convinced that 95% of us are in the middle.
I agree.
You know what? I'm okay with that 95%.
Mm-hmm.
I don't waste time over there.
Mm-hmm.
I just don't.
I agree.
And
I agree.
I think that's what keeps me going. I just, surround yourself with people that are forward thinking. Mm-hmm. And that's a great way to live life. I mean, just, it helps you grow and stretch. And that's what's fun for me.
Awesome. Well, thanks for this time. Thanks for your work. I highly encourage you to go to, say the websites one more time so they get that.
It's theclinicalcompass.org. Mm-hmm. And to get the paper, it's the Journal of Chiropractic Manual Therapies. And if you just look that up on Google, it'll take you right to it. Scroll down, you'll find the page. Just look for cost effectiveness and click on that paper, and you can download the paper for free.
Love it. Thanks, Ron. Appreciate you.
Thank you.
Mm-hmm.
All right.
We all have paradigms and roadblocks that prevent us from excelling, and they can be real or imagined. Welcome to Beyond Bricks, a podcast that will give you the ability to break through those walls. Here's Dr. Nathan Unruh.